everyone. I am Markeisha Woodson with the Aurora African American Health Coalition. Thank you for joining us again today. This is part two of our webinar series on advancing cultural competency. Again, May is Mental Health Awareness Month, and we want to make sure that we're focusing on mental health for Black women. With us again is Dr. Adrienne Skinner, who's a licensed clinical psychologist and a trauma specialist. The second part of this workshop is titled Cultivating Mental Health and Wellbeing in Black and African American Women. Dr. Skinner, I will turn it over to you.
Thank you, Dr. Woodson. I appreciate it. Good afternoon, everybody. For some of us, this is the end of our work week. So if it is, you made it. For those of us that still have to keep going, keep going. Okay, so as Dr. Woodson said, this is part two of the series on increasing cultural competency with providers. This is specifically cultivating mental health and well-being in Black and African American women. I will. Okay, so the objectives of this one today is to provide a framework and some considerations and strategies to create a more inclusive and safe therapeutics setting for Black and African American women. And I'll go on to say this in a little bit, but when it comes to therapy and maybe even healthcare settings in general, they are still a place where women, Black and African American women, experience disparities and have a lack of trust due to some of the historical context of which healthcare has been denied or the access to care has been very difficult to achieve. So, this is one area where we can go ahead and hopefully make it a safer space for Black and African American women to sit and be able to process and to take care of this part of their health, because mental health is part of overall health, and there is that true connection between mind and body. Um, so I got the last objective from the flyer that I really liked. I don't know who said it, so I'm giving credit to whoever, props whoever said it, but this is also an opportunity for us collectively as mental health providers to reimagine care that truly understands and honors culture, identity, and the lived experience, and in particular for Black and African American women. So I wanted to go through and talk a little bit about why I'm doing African American slash Black versus just using the general Black for every as the descriptor or African American women. And really, the safest bet is to just ask the person in front of you what is their preferred identity, and then to go from there. But I just wanted to say that they're not necessarily interchangeable. For some, Black is an overall, it's not just about well, let me start off with this. African American isn't something to be used to be described for the overall worldwide identity. It can obscure some of the ethnicities of other nations such as Nigerian, Kenyan, Jamaican, Bahamian, Puerto Rican, or Panamanian. And in that case, when we're not talking about of that sort of the ancestral descent is from Africa, use Black. For myself, I use Black as my identifier because mine is actually from the Bahamas and also from Ireland. Okay, so just wanted to put that out there as to why I'm using, you'll see those, I will use both of those. And again, the safest bet is to ask the woman what is her preference. So as I said last time, in the previous training, why is it important for us to talk about the disparity or how to create a better setting, a safer setting for Black and African American women? It was from the Surgeon General's report on mental health in 2001, and it was the inaugural Surgeon General's report. Since then, there have been updates with the previous, or excuse me, with the other presidential administrations thereafter. But like I said, this was the first one. And the quote was, "For early childhood until death, mental health is the springboard of thinking and communication skills, learning, emotional growth, resilience, and self-esteem. These are the ingredients of each individual's successful contribution to community and society, successful performance in school, work, parenting, and relationships. And it is upon which the foundation for mental health rests. So when we started to talk a little bit about, like I said last time, about the cultural competency, that there is, and even in our formal trainings, there's a lack of that, and talking about multicultural and in particular care as it applies to African American and Black women. And so in further going on and looking more at the research and the literature that was out there, I came across another fact that didn't make it up onto the slide, so I'm just going to read it. It says in 2001, the Department of Health and Human Services identified a need to address striking disparities in mental health, noting that members of racial and ethnic minority groups consistently had less access to mental health care and received poorer quality care than whites. And this is from a book from by Monica Williams, Daniel Rosen, and Jonathan Cantor, and it's Eliminating Race-Based Mental Health Disparities. Um, and so I wanted to go ahead and continue to highlight the fact that even as recent as maybe a couple years ago, we're still noticing, and it's still a common thing with the increase horror, the racial horrors and tragedies that are happening, that healthcare and mental health care, there's still a huge gap that's dependent upon the zip codes in which we live, regardless of our socioeconomic status, regardless of our educational levels. That doesn't matter. There's still a huge disparity when compared to our white counterparts. Okay. This says, something else that I like. Let me, oops, sorry, you guys. Let me move this just because I can't read it. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. This is from Dr. Martin Luther King. As I said the last time, the next one is from Dr. Tamar Bryant. She was the president of the American Psychological Association in 2023, I believe. Justice is healing and justice is therapeutic. The last one is from President Barack Obama. Ensuring access to quality, affordable health care helps create the opportunity for all citizens to achieve the American dream. Despite advances in medicine and technology, disparities remain in our healthcare system for too many Americans, including racial and ethnic minorities. Okay. Going forward, and this is what I was saying before, that healthcare is one more area where racial oppression is experienced. Even when we take into account, like I said, access to health insurance, socioeconomic status, an educational level, it doesn't matter. There's still the access or the quality of care is still considered to be less. This is also contributing. Also, what contributes to that is the worldview of racial and ethnic minorities to be. Oh my goodness, let me just do that part over. Excuse me. What else is tied to that is the worldview of racial and ethnic minorities. That we're gonna start that over. This is a practice in dealing with being imperfect and just kind of going with it. So excuse me again. The historical worldview of racism and oppression in the US. That is still impacting the healthcare access again and the quality of care experienced by racial and ethnic minorities. Okay. So why again is it important for us to focus on the mental health of Black and African American women? It encourages positive mental health and well-being, which then translates into individuals with a higher self-esteem, that also then helps to, it flows into positive parenting, or we'll say mentoring, because not everybody is a parent. It is also flows into a higher quality of life in terms of being able to take risks. It also it spills over into the idea that we can go ahead and provide and contribute to society in a way that is specific to us and the way that we are created to be. So here are some definitions about mental health versus well-being, and they're not necessarily the same thing. So that mental health is a state of mental well-being that enables people to cope with the day in and day out stressors of life, that they are able to learn well and work well and contribute to their community. Well-being is also a sense of how people feel about their life, and that it's strongly linked to the happiness of life and life satisfaction. What I was, as I was saying, the quality of life that one perceives. In short, well-being could be described as how you feel about yourself and your life. So, what are some of the things that get in the way of that can impair or impact? No, let me rephrase that. What are some of the things that can negatively affect Black and African Americans' mental health and well-being? I'd said a few terms in the previous training, and so now I'm going to go ahead and define them. One of them was gendered racism, and this infographic explains what it is. It is the overlapping lived experience of Black and African American women, where they are experiencing oppression from their race, along with the oppression that comes from their being female, and how that then lays over and impacts their day-to-day life and adds an extra layer of chronic stress and affects, like I said before, their sense of well-being and mental health. Further, it uh, when they are experiencing different forms of, in addition to this form of racism, there are other ones that come about as well, in terms of also being in the workplace, and how do you come across in the workplace as, are you, if you are going to advocate for yourself, are you the angry Black woman, or do you go ahead and have to appease and be quiet for fear of disrupting the status quo? So what are some of the approaches that somebody that is providing services, therapeutic services to Black and African American women around this topic that is very much part of the lived experience, and that some people aren't ready to voice this, so there has to also be some tenderness, if you will, around being able to talk about this, because it's a very vulnerable area to talk about racism, much less now you've got the oppression of being a female, both things that are, while they're wonderful and great, you didn't necessarily choose to have them. Okay. So some of these approaches were the intersectional identities of Black and African American that ignore them, deny, or don't integrate them actually can fall short and create more harm by adding to the chronic psychosocial stressor of gendered racism. And so, like I said, being able to take into account, to have some awareness as to race and culture and racism within the society in which the individual community lives, this also is an opportunity for you as the provider to take a look at your own implicit bias and any other sort of um, biases that you may have regarding Black and African American women, as well as Black and African American culture. Okay. The next term that I talked about before that I'm going to cover here is called weathering. And this was a term that was coined by Dr. Geronimus and out of the University of Michigan. And this is where describes the biological aging that Black women experience as a result of stress due to racism, poverty, and other stressors. They suffer, and this is when I said last time was the Black don't crack and brown don't frown. You'll hear that, where it's like Black and African American women may look younger externally, but actually when compared to women of the white women of the same age, they've aged further along on the inside or internally. So part of the condition for this, or the effect of weathering is that Black and African American women experience more health concerns when compared to other women of other racial groups. They suffer more chronic illnesses, have higher rates of mortality. They have higher rates of the infectious diseases, which we saw during COVID, um, in terms of just availability for testing and even actually being able to be seen in emergency room settings. Uh, in addition, due to some of the aging process, the chronic stressors, Black women are more likely than white women to experience somatic symptoms in response to depression and anxiety. And I'll say this a little bit later, that some of the depression and anxiety may also go ahead and manifest in somatic ways, more bodily ways. And so for us as clinicians, providers, to go ahead and have some insight and into it as to, wait a minute, is what they're experiencing when they're saying, oh, their body aches or their stomach hurts or their back hurts, like, and is it some, are you experiencing the health concerns, or is this another way to experience or to express depression, anxiety, stress, things of that sort? So as I just said, approaches that support African American and Black women in recognizing this intimate connection between mental and physical health and well-being improves their overall health and well-being. So then that also, I talked about this too, the strong Black woman persona, that kind of loops back in with what I was just saying. And this is where it's a persona, but it's also can be adopted as a lifestyle, that it's described as being that Black women are taught erroneously that we are supposed to be able to handle everything. And if we can't, there's something that's wrong with us. And that this idea that there might be something wrong with us um, might stop people from seeking help. It furthers the stigma of mental health and mental illness within the Black community. And it also encourages or cultivates, I'll say it this way, the sense of silent suffering that is also found within the Black and African American women part of the population. My guess is in others, but we are focusing on Black and African American women. So as I've said before, this this the while there are a lot of wonderful um positive attributes of this, it also does come at a cost. You're going to have chronic stress, this idea of Black fatigue. You sometimes hear it's hard to be Black in America. You'll see more depression and anxiety. And then there's also this idea that there's little opportunity for Black women to pay attention to their own needs, their own self-care, excuse me, because it's not seen as a necessity. It might be seen as a luxury, and we got to take care of all the others before we take care of ourselves. So the idea of the air mask on yourself first um falls into direct conflict with this idea and this lifestyle. And again, this is a little bit of a cultural thing too. So going on and saying you absolutely have to do this, you're going to have to, as a provider, kind of walk that line of, well, how is there a way to have still encourage some of the strong Black woman, those positive characteristics, along with encouraging their rest and recovery, as I've been saying in this last one, of to be able to have them both, that it doesn't have to be an either or, it could be a both and. And some other ways to be able to do that is to work through some mindfulness approaches, um, being able to help women come up with different strategies to incorporate periods of rest and recovery and try to figure out how to protect those periods of time, not as a way to say it's going to be at the cost of other people, but as a way to pour into themselves so that way they can go ahead and honor whatever roles and whatever demands are being put on them at that time. Okay, another area is talking about the social determinants of health. This falls a little bit also into with the the overlapping that I was talking about before with the gendered racism. this is not only one way to, this is one of the frameworks that you can go ahead and take a look at or use, I'm sorry, use with Black and African American women, but it is also it's a contextual framework. It is also a way to get some more information as to what are some of the barriers and also what are actually some of the protective factors that Black and African American women may be experiencing. So, like I said, it's a useful guide to understand the connected and interconnected systemic and individual factors that influence Black and African American women. And again, it can be very contextual. And there's individual levels, there's provider levels, there's um, community levels, and it is, this model is, it's amazing, and it is doesn't, we don't have enough time to go into it. I just wanted to go ahead and highlight this because it is one of those models that is a really a holistic framework, and is definitely more contextual and a culturally responsive way of looking at and gathering information regarding this the history and the stories of Black and African American women. Okay, so some other the next two slides are other ways of or other frameworks, I'll say it that way, when we are wanting to approach um, working with Black and African American women, that, you know, making sure that the approach that you are trauma, that it's trauma informed, because again, racism is a form of of trauma. There, you know, the racial stress and trauma that is experienced for people of color. You've got, again, on top of that, the layered issue of the femaleness of being a female, and you know, that oppressive layer. So being able to go ahead and look at it from a strength-based approach. So that would also be, like I was saying, with the strong Black woman persona, identifying those positive aspects, still holding and honoring the fact of what it costs, but being able to build upon those and highlighting that and celebrating that, creating this space for the woman or the female to go ahead and sit with that. And that is really hard, especially if they are sitting with a non person of color, because that requires a level of vulnerability of, I can go ahead and I can take a moment to just sit in this space where I can celebrate myself, where I can go ahead and look around and say, despite all of these things, and in spite of all these things that are coming up against me, look at all of these very cool attributes of myself, of my family, of my ancestry, of my history, that I have been able to stand on the shoulders of, to continue to be in this place where I'm still standing, maybe upright, or at least I'm able to sit, maybe a little bruised and battered, oh, you know, metaphorically, but I'm still here. It helps to give a sense of empowerment, that sense of internal locus of control. It helps to build them up and to fill them up, to give them that space to do that. Trauma-informed services also help the individual to focus on the resilience factors, and this is what the next slide will say, so I'll just say it here. I'll just go ahead. Is that it helps, resilience is this the ability to bounce back, to work through that. The only way to get through a situation is to go through it. And so when you can go ahead and you can point out the different aspects of this individual that has chosen to live and work and play in the community of their choice, and to be able to still have a life that is full of meaning and purpose, to have work that is full of life, or that is full of meaning and purpose. That's a very, very powerful place for a person to come from. That is a very much of a place where women, and Black and African American women, can rest in, but then also be able to pull from internally to go out and to fight again another day. So resilience in it when dealing with other with African American women and Black women, it builds on their existing resources and views her as resourceful and resilient, not just I have to get along to go along. The individuals who have experienced the trauma, they may develop all these other strategies to adapt to it emotionally, cognitively, spiritually, and physically, the physical consequences of it. And being able to say, wait a minute, yes, as Gabor Mate says, trauma isn't necessarily what happened to you, it's what happened inside of you. And that is the event that happened to you is the traumatic experience. It's being able to say, wait a minute, this is what's happening on the inside, and being able to let that person know that look at despite what's happening on the inside, you're still here and you're still ticking. And that is a very, again, like I said, a very empowering and not necessarily a view that is celebrated in the day-to-day life socially. We'll just say generally speaking. Okay. So I'm going to close up this part of for today. And I know I spoke a little bit quickly, but I wanted to make sure that if there's some questions that we had time for that, because I don't know if we had a lot of time last time. But I want to leave people with this idea and some questions to think about. That this is a quote from Dr. Cozzolino. It says, "We are not for the survival of the fittest. We are survival of the nurtured." So I pose to those that are here today, which again, I celebrate you for being here and taking time out of your schedule today to do this. I want to put out there to you guys that how do we as mental health providers help to ensure the survival of the nurtured? And the nurtured here is Black and African American women. And that how can we as folks who responded to the call to aid in the mental health recovery to of facilitating resilience, thriving, and flourishing. How can we continue to show up for them, for the Black and African American women? So it's not only a call for helping this population, this segment of the population, but one other thing that I did not put up here, but I also want to include is how do we continue to show up for ourselves? Because this is daunting work. This is not for the um this is not for the weak of heart. It is a lot of work to sit with all of the different barriers that come up when we are sitting with a Black and African American woman, and it may strike up some of our own things. And so, again, like I said before, getting as much training as you can on implicit bias, being able to make sure that as mental health providers that we are taking care of our own mental and physical health. That is not a luxury that we really have. It's a necessity. And I think being able to go ahead and have access to trainings from people that don't look like us, because that's going to bring its own sense of difference, if you will, diversity, and knowing that difference doesn't equal bad. So that is the presentation for today. I really want to thank you guys for being present with me today, for giving me that space and that grace to kind of fumble through this as you know as I have. And I'm just going to go ahead and open it up for any questions that we may have. Before we go over to the questions, I wanted to address two I am working to compile a list, and it's taking me a little bit longer than I had anticipated, of the resources that that can be made available for Black and African American women, and then as well as resources for us as providers to continue to um, encourage our own cultural competency. So please be patient with me. I am working on gathering those things. That is all I have.
Thank you. Thank you. As always, much appreciated. There are a few questions. I will read them and then give you an opportunity to ask more. If there are others on the call that would like to ask questions while I'm going through this, please feel free to either send a chat or put them in the Q&A. So the first question is, how can therapists respectfully, I think that is, integrate clients' spiritual or religious beliefs into treatment, particularly when when these beliefs are central to a client's identity.
So I think in some respects that is kind of a two-part question that needs to be teased out, that spirituality and religiousness is not always the same thing. And so being able to ask that, um, even asking some curiosity. I think anytime you ask curiosity, things with curiosity versus judgment, that's demonstrating and communicating a respectful integration of that. If you are not sure as to what those practices are, ask. Ask them if there are any sorts of resources that they may have, but don't leave it on that person to be the token, whatever the spirituality or spiritual practice or religious practice. Go out and do some of the your own research, and then actually bring it back into the next session and talk about that. That demonstrates that you heard what this person said, that you value what they said, and that you're willing to join them in an area and learn more about how this plays a role in their lives, in either in their hopefully, well, not hopefully, but in their way of living their lives fully.
Thank you. The next question, what are some effective ways to build and maintain trust with Black women in a therapeutic setting?
Hmm. I think being able to, if there is a racial, ethnic, or cultural difference, um, not being afraid to speak about that, not being afraid um, to sit and to have that conversation with your person. I think being able to also, again, this is the where having your own training and your own implicit bias comes really really handy, is to know what are some of the preordained or preconditioned ideas that you come in with that may come into the therapeutic space. And then, there's gonna be times where we make mistakes and we might offend them. Being able to own that, apologize, and work on that rupture and repair, but it's gonna happen. And acknowledging, oh, that is, I made a mistake. Please, I no offense to, I did not mean to offend you, but recognizing too that, and this is where talking about or in doing your own research and sitting with the own discomfort of racism, and we're, here in the United States in particular, um, that is part of doing this work. That is part of the hardship that I was talking about, of like, it's not easy. This is not for the faint of heart, sitting with this, with the gendered racism, we'll say that part, because it's a very much of a reality. It's not something that has happened. It is something that is continuing to happen, and that whether whether we want to acknowledge it or not, it is a part of the lived experience, um, of Black and African American women. And the other part that I just came across recently, in this other group or other training that I was participating in, is sometimes, and this is the interesting part, is that the Black or African American woman may not be able to name what is happening. They may not be able to identify, like, oh my goodness, I am on the receiving end. They may not have the words to put it. They may be able to talk around like some of the characteristics, but this is where being able to say, huh, I wonder if this, if talk, again, not being afraid to talk about racism, um, and gently talking about that, but allowing that individual to sit with some of that, and creating a space, a protective space that can help to have somebody to help build that trust with the Black and African American woman. I hope that answered the question.
We don't see if they don't say anything. I think we're good.
Okay. Okay.
This next one kind of ties into what you've talked about with the first two, actually.
Okay.
You mentioned implicit bias. How can clinicians identify and address implicit bias in their therapeutic practices?
Mm. Well, I will speak from myself with that is one, it is part of our training, our licensure requirements to renew. So we have to go to training for that. Um, and I think you just got to jump in and be like, I might, because we all walk around with them, and it's part of just the human experience. I would say you go and you get training on what implicit bias is, and then usually within the implicit bias trainings, there are some exercises that talk about your own and being able to discover some of your own implicit biases. And I'm not necessarily going to say go to this one versus the other one. I mean, that's going to be particular to the provider what your learning style is. But I would say definitely you when you start it comes along with the lines too also of some transference and counter transference. If you're finding that this is starting to come up, that's where coming into having support either with some other peers, consultation, if you're at the almost the pre-licensure level, the supervision, you bring that as you would with any other sort of case consultation. You bring that in. Again, it's not something, it's not doesn't make you a bad clinician. It doesn't make you this horrible human being because you may have these ideas or these preconceived notions. It makes you a human being that is going just as much about their your own healing as a healing as a person is that's sitting across from you.
Um, I'm going to jump around because the next question piggybacks off of what you mentioned about with supervision.
Oh,
How can supervision and continuing education support ongoing development of cultural competency among mental health professionals?
okay. So part of that I think is being able to look for, and again, I will speak as a psychologist because that's my wheelhouse. We have certain criteria, and I do believe that LCPCs and actually LCSWs, we all have these multicultural buckets that we have to fulfill in order to get to renew our license. That's just now becoming part of it. And I think even physicians have some of that as well. And if not, then we all, or prescribers will say it that way. Um, it would behoove us to go ahead and seek that out because the diverse we no longer have the luxury back in the day when I first started doing this over 20 years ago. Geez. Uh we would all have these little bubbles, these little professional bubbles that we could just sit in and be like, do do do. This is all we're gonna do. No, that is no longer the landscape of things. As our world and our communities become more diverse, it would behoove you to go ahead and to seek out if it was not part of your formal education, to seek that out, whether it is through some professional trainings, even if they don't even offer the continuing education units. It would behoove you to, when you are looking for supervision, if you're going around or consultation, because those are different things depending on licensure level, to ask that person that you are receiving supervision or consultation from, what is your training and stance on multicultural and cultural identity and development, cultural competency, because you want to make sure that is part of the treatment plan, part of your contextual framework, your case conceptualization, because if we don't take into account that part, we are doing a huge disservice and could be missing a complete part of the treatment that is important. And that is a blind spot that can be actually be avoided. It can also be something can be avoided in terms of doing harm. We that is part of our code of ethics is to do no harm, no malfeasance. To disregard that altogether is kind of venturing on that. And you don't want to do that. We don't want to go down that rabbit hole. That's not good.
Thank you.
Yes.
Um, Another question, and you talked about this kind of as you wrapped up, but are there any tools that you can recommend to help clinicians evaluate their own cultural responsiveness or that of their practice environment?
Okay. So they're actually that is part of what I wanted. I'm working on compiling is that list of the being able one of the great resources that I have found that I've really pulled a lot from is the SAMHSA's oh, I'm blanking. It's one of their treatment informed practices. There, it's a TIP is what it stands for, or is the acronym for it. That actually talks about um, culturally competent spaces, and it goes through and it lays out what that looks like for and it could be either a group practice. I'm in solo practice, so I'm by myself, but I am interacting with a very diverse population. I'm also African American or Black, and so it's kind of cool to be able to for myself, just my own personal development piece. There are also, it is, and this was also going on the list, but let me just read it. Another resource that I really like is the Eliminating Race-Based Mental Health Disparities. That's another book that talks about just that, and it goes through and it describes some of the different methods, different interventions that can be used, but as also a way to go ahead and make sure that you're providing appropriate multicultural um, services. But like I said, I'm working on compiling that list. It actually, I was really really impressed and almost brought to tears when I was like, oh my goodness, I wish this would have been around the 20 some odd years, almost. Oh geez, when I started, it would have been amazing instead of trying to pick and like scrap some stuff together to duct tape it together. But now we've got a lot of research that, and especially probably within the last 4 to 5 years, you're seeing a lot of resources that are coming out to help with that. I would also, this is something that I find really cool, is I would not be afraid to go into different fields. Public health, amazing resource. Do not be afraid to vent. Yeah, right. Because, oh my goodness, the epidemiology. Oh my goodness, what a wonderful resource it is. Um, and Dr. Woodson, I don't know if you, off the top, if there are something that you can from the public health sphere that you can go ahead and like just a resource right away. But that, I just know that that has been, I have dipped into that to help inform a lot of what I'm doing and what I'm providing. Um, and again, one of them, yeah, like I'm pulling that together.
We have a lot of resources on our website. We've started developing out different resource tabs that is more specific to that. But I will say that the lens that we take in general when looking at mental health is identifying just the social determinants of health and kind of starting from there when we
Yeah.
look at that and recognizing that the impact of race, right? Recognizing the impact of race, how people respond and being just aware of it. Our biggest thing is that cultural sensitivity and awareness.
Hmm.
We try to lean a little bit away from cultural competency in the language at that because there's just a bunch of back and forth with that. So it's like, even if you can't be competent, be aware, be
Right.
sensitive,
Yeah.
right? So we look at that and really how all of those things intersect, which you talked really good about intersectionality. But it is on our website, and once you get your resources together, we will also put them on our website where you can go and navigate those different
Okay.
tabs. So
Cool. Cool.
thanks. Another question. What role does community and cultural identity play in supporting mental health for Black women?
I'm not fully sure I fully understand the question. It feels like there's a couple of questions that are,
In one,
yeah, and so can you read it one more time to me?
what role does community, I guess these are separate because community and cultural identity is not
Yeah,
necessarily the same thing,
not
but what
necessarily.
role does community and cultural identity play in supporting mental health for Black women?
Okay. So I think even just what just happened right now is being able to say, wait a minute, I'm not really sure I'm hearing correctly, right? And that's asking, going in with asking for questions for clarity, because now what you're doing is you're communicating. I'm listening and I am following whatever it is that you're saying, and I'm engaging with the information that you're putting out there, but I am not fully understanding. So I'm listening to understand, not to respond. That is actually just one way to circle back to the question about trust is listen to understand, not to respond, and not to think that you're here to fix something. So when we talk about cultural identity, again, those that's can feed into community. Community can feed into cultural identity, but they can also be separate because you can have an individual that has a very strong sense of culture and identity, but not feel like they have a sense of community. Um, and you can see that a lot when somebody is working in a predominantly white space or going to a predominantly white institution, a very strong sense of that. But when you look around, you're like, oh, I am literally a pepper speck in in a sea of salt. That is not necessarily a sense of community. So part that is actually part can be part of treatment focuses. Where can you find a sense of community? You may be specifically in that space for a reason, but that doesn't necessarily mean that you are alone. Or if you're feeling lonely, how can we go ahead and help you find that support system, some of those peer supports, and being able to help the individual navigate that search. That's actually even a treatment strategy that is highly recommended, regardless of what it is that the individual walks in the door. But to speak of it as, and I'll look at it as, I will look at it again separately, that they can very much be protective factors and pillars of health um, for a Black and African American woman, knowing that they are not the only one that is going through whatever it is that they are experiencing, can help them to feel like they are being wrapped in or enveloped or encased in a sense of, excuse me, a, I don't know, I'll say it like that, a sense of oneness with others, that they're not the only one that's experiencing their hardships. So being able for them to even look out, I would say maybe finding a role model to look for. Again, the cultural identity piece, if they're not really, if they don't know, maybe even being able to ask somebody that's in their family, well, who are my people? And I'll use that a very loose, like where do I come from in a non-pejorative way? But really, what is my ancestry? Um, and I know for myself, like I said, mine is Bahamian and Irish, and so that's a really interesting mix. And when I've asked about that, it is really, really interesting. And so being able to pull on that and it's real, it has given myself and then to pass it on to my son, like, dude, this is where our people come from. It gives you a sense of groundedness, that you are not being like tossed back and forth, but that you have a sense of being able to again stand on the shoulders of people that have already done this. You can continue to push forward, and you can go ahead and do for the next generation to come, to pass that legacy on. But again, they can both be their protectors and pillars of health, protective factors and pillars of health.
Thank you. Last question. What
Yes.
are some common barriers to accessing mental health care and how can therapists help mitigate them?
Where do we begin with that one? I'm gonna start with an almost, and I said this the last time, that I think it's 4 to 5% of mental health providers are um, women of color. So even just the presence there, to be able to pick, if you will, right, to have that as a resource. Um, it's not necessary for you in order to provide services, but if you are a Therapist of color, taking trainings on that. You can do that in terms of access. Barriers would be sometimes it's insurance is a huge barrier. Lack of availability of clinicians of color, long wait lists. Sometimes I would even just say physical access to getting to like somebody's office. So if it could be where you are comfortable offering virtual sessions, sometimes that's that because sometimes they can't, people don't have rides or anything of that sort. Um, Stigma is going to be a barrier. Like as I was saying before with that strong black woman persona, that's a big one too, in terms of it being a negative aspect of, well, I can't ask for help because if I ask for help, then there's something that is inherently wrong with me and I'm not able to pull myself up and keep on pushing on and pushing through. In terms of what mental health clinicians can do to you can there's a lot of ways to advocate on a legislative level, offering services, volunteering your services for people. You could do something of that nature. Um, Seeking out opportunities to do talks such as this, and also, I think just being able to identify even on insurance that you are willing to that is for some people they don't know that you can pick the populations you want to serve, being able to put it on there that you are willing to serve cultures of communities of color, that is something even too just from right there that you could go ahead and do.
Thank you. That was our last question. Thank you again. It is always a pleasure having these workshops and having you join us. You've been a great part, a big part actually, of what we've been doing for the past few years. So it's always appreciated. Thank everyone for attending. I'll leave you with this. We have a couple workshops coming up at the end of this month and over the summer for our Man Alive program, which is focusing on mental health in men over the age of 50, but we're encouraging men who are over the age of 50 to also bring their sons or uncles or cousins that may be a little bit younger to those workshops. Also, feel free to follow us on all of our different social media. We're still working on getting those platforms up and going. But thank everyone for their attendance today and be looking out for more things to come. Thank you.